All right, it is Tuesday, April 21st, and this is our weekly update again for COVID relief in Kenya. We have again the pleasure of having Dr. Claire Niambati with us. How you doing, Claire?
I'm doing good, Gert. How about you?
We're well, thank you. We're everybody's healthy, and we're trying to figure out how to get back to normal over here. Claire, give us first. I think I got to start with how Mommy and Tyler are doing with the homeschooling thing. Everybody wants to know. So tell me how you're doing over the last week.
Yeah, so Mommy is still learning those skills on homeschooling, but the problem is my son Tyler cannot seem to accept or understand that his mom can be a teacher. So just trying to accept that change is going to be a milestone for me.
Well, you're not alone. There's lots and lots of parents over here having the same problem you're having. But we'll give them our best, if you would. Claire, let's start this week just by giving everyone an update of kind of what has changed in Kenya, kind of countrywide, since last week's update. New government policies or restrictions, the feelings of the Kenyans around the virus. Tell us what's changed in the last week.
So let me start with the number of reported positive cases. We are at, as of 20th April, we were at 281 positive cases. As number of deaths, we had 14 confirmed and 69 recoveries. So far, the geography of COVID-19 for the confirmed cases is still in the same 18 counties. There was a case that we had that was a suspected case in one of our communities, Irigidadi, but following follow-up and a confirmed case, the case turned out negative. So that is positive for us as a Fortin Bridge community. As far as the government directives are concerned, they are being enforced actually at community level, whereby new community policing has been introduced, whereby anyone who violates any of the directives that were given by the government will be reported by community members. So there's a specific number they have given. Now, in terms of the reaction of Kenyans in general, and even at our community level, in the beginning, I would say there was really not much fear, but people thought that this would just go away in a couple of weeks. But with the reinforcing of the directives and the cases that we are seeing are increasing and the lockdowns in the certain counties, people are now starting to realize the reality of the COVID-19 and seeing the seriousness behind keeping with the directives of the government to prevent the spread of COVID-19. So among the testing for the persons countrywide, we haven't yet rolled out the mass testing. We only have the mandatory testing for healthcare workers across the country as the first phase of this. And hopefully the next phase will be to roll out a mass testing to specific hotspot areas in our country. And we expect to see that in the next couple of weeks. If we will have enough testing kits, then we would be able to do that. Now with this, we would be able to confirm the actual spread of the disease across the different counties in our country, and it would enable us to respond better in terms of controlling the spread of COVID-19. I would say in terms of building capacity, the government is also trying to focus on trainings for healthcare workers. These include the community volunteers, and it has also dedicated a specific facility to be able to cater for healthcare workers who get sick during this response to COVID-19.
So masks are still mandatory, and I understand that the government is calling on people to report any violations of the restrictions. Is that right?
That's right, Scott. And we are seeing that in our communities, the community members have actually adhered to this directive, and anyone who is seen in public is wearing a mask. Just like a positive side to that is that we have BST beneficiaries who have taken that as a business opportunity to be able to make masks for their community members.
Yeah, good. Good. So let's talk a little bit about the communities. Over the last week or so, you guys have been working hard with community coordinators, leadership councils, church leaders to really help the most vulnerable people in our communities with food distributions, food kits. I think we've got some photos that we're going to show as you talk maybe of some of that distribution. But tell us what's been happening in the communities in the last week around the food kit distributions.
Yes, so we were just winding up with Chembulet, one of the communities that still had to do the food distribution. And the church is just coming out to be the hero in all of this. And we are grateful for that opportunity that God gave the Fort and Bridge to be able to do that through the churches. It has actually united the churches in terms of they came together and they've seen that this is a platform that they can use to even further the kingdom. So what's going to happen in the next week is that they are coming up with a schedule on how they're going to use like megaphones to be able to continue sending out messages to the community, both pastoral messages, biblical messages, as well as raising their awareness on the prevention of COVID-19 and how to respond if one thinks that they are a suspect to the case. So we still have the WhatsApp groups, the platforms for information sharing, for encouragement, and even using it for capacity building. And this goes across the different target groups in our communities. That's the pastors, the BST beneficiaries, the foundations for farming beneficiaries, parents of children under the sponsorship program. So we are taking advantage of that platform to do just that. As far as education is concerned, we are looking at a specific group right now that is the class 8 students and the Form 4 students, whereby we want to group them through their teachers in groups of not less than 10 to be able to carry out practice exams. So we are physically distributing those practice exams. Then they'll go into their house, do the exams, and then the teacher would do the marking and monitoring so that we can be able to assess the performance of the students even while they are out of school during this time.
You said groups of not less than 10. You mean groups of less than 10, right? Because that's the government mandate, right?
Also,
yeah. Right.
Yes,
Just make sure that that's right. Okay.
Yes.
Great. All right. Keep going. Sorry.
Yeah, and
as it relates to the food kits, Claire,
food distribution.
Yeah.
We had community members coming in to actually contribute across the communities that we had the food distribution, and I mean these were contributions from sacks of maize. And just seeing them coming together was quite an encouragement for us, just to see how the community also wants to be part of the solution to the current situation.
Yeah, I saw a report that kind of itemized the contributions from the communities, whether it's secondary school parents or pastors or just farmers in the community donating maize and beans and rice, or not rice, but soap and jerry cans, just even financial contributions to help the most vulnerable in their communities. That was awesome to see.
Yeah, and it was mainly due through the WhatsApp groups that these target groups were able to be reached, and they were just voluntarily decided to be part of the distribution through contribution.
So just so everybody knows, the WhatsApp group is trying to create a WhatsApp network, people where Bridge can distribute content to leaders in the community, and then they redistribute that to their various groups, whether it's Foundations for Farming group or a BST group or their church. Is that
Yes, that's exactly what we are using those groups for. Apart from the encouragement part, is sharing information, any information that come in that includes updates, sharing also possible training materials and awareness materials that they themselves can be able to use to educate their community. And actually in our BST group, we even shared a video on how to make masks using cloth. So even being used as an education or training platform for the for the community members.
okay? So Claire, we're going to run out of time here. So, but I would want, before we wrap this up, I'd like to get a sense from you. I think people want to know what you see on the horizon, maybe 6 to 12 weeks. What do you see happening in Kenya in our community?
Yeah, I'm concerned about that part, Kurt, because with the rolling out of, God willing, the mass testing and increase in cases that would be identified, there will be an increase in the pricing of commodities in the communities, and this would mean that even community members may not be able to have access to enough food that they would under normal circumstances. And I see this happening around June to July, whereby we would have an increase in the price of commodities that community members would use as part of their food. So it's a concern, Kat, not personally, even countrywide, it's a great concern. And we are looking at more community members getting to that need. But by June, July, we are looking at that being one of the top priorities for community members.
So I know your staff is working on trying to figure out what we can actually do to prepare for that. And that's a very difficult challenge, I know. But well, Claire, we appreciate it. How are the staff doing? Everybody healthy and good?
Everybody's healthy, everybody's good. We continue with our daily devotions, and we are meeting every week, every Friday, just to catch up with each other and see how we are doing.
Yeah, great.
Yeah.
Well, anything you want to share with people before we wrap this up?
Well, I just want to thank you guys for putting up with me to the end of this video session. But anyway, on a serious note, we just bless you. We thank you for the way you continue to support us as an organization, support the communities. And I tell you, you really are making a big difference in the communities through your support, and they see it.
Well, Claire,
Thank you.
We appreciate you and all the work that you and your staff are doing. The leaders in the churches in our communities, we're grateful for all that. Thanks for this update. We'll be talking again next week. Take care of yourself. Go try to teach Tyler some math or something. I don't know, periodically, but good luck with that.
Yeah.
Thanks, Claire.
Thanks,
we'll talk to you
Scott.
soon.
Bye.